been a patient of our practice for about a year and a half, and if I'm not mistaken, you've had pain for about 5.5 years in your lower back.
Yes, I have.
You saw us about a year and a half ago, and you had this procedure done about a year and a half ago, correct?
Right.
And did you get some relief back then?
Absolutely. Yes,
Okay.
I did.
And had you had any relief of your pain since 2011 to last year? Had you basically had anything else that had helped you out at all?
Nothing. Nothing at all.
You had physical therapy and tincture of time, and nothing really had helped you at that point.
Right.
And you got relief for about a year or so from your procedure last year?
14 months.
14 months, okay. So Dave had this procedure done 14 months ago and did very well, and essentially the pain has recurred, the same type of pain. Tell us a little bit about where you have your pain, Dave.
Lower back. My pain is in my lower back, and it is especially painful when I get out of bed in the morning. That's the worst time.
So the morning is the toughest time. It's stiff, feels like a stiffness. And that's one of the things that you'll find in patients with arthritis of the spine, which is why you're pretty much doing this procedure. People will have a lot of pain in the morning, difficulty getting out of bed, and stiffness in the morning. You don't really get a lot of pain radiating down your legs.
No.
And we have different treatments that we can do for that. But for today, this is primarily a procedure that's done for lower back pain without much pain that radiates down the leg, just primarily lower back pain. In this case, it's due to arthritis of the spine, which is what Dave has. And essentially the procedure involves deadening some of the nerves that supply sensation to the joints in the spine. There are little joints in the spine that we'll show you later called facet joints that have a small nerve which supplies sensation to them. And by burning that nerve, similar to burning the nerve in a tooth for root canal where you can deaden the nerve in a tooth, we can deaden the nerves in the spine and alleviate pain from the spine. Unfortunately, these nerves do regrow, they do regenerate, and 14 months later the nerve has grown back and the pain has returned. However, it's a fairly simple procedure, as you'll see, and to get about a year or more relief from a very quick procedure is well worth it.
Okay. Bike, and before I had the procedure done, I couldn't go further than 5 miles. I'd have to stop and get off the bike and kind of stretch out and recover and then get back on the go again. And after this procedure, I'm back on my 25, 30-mile rides, relatively pain-free. It's been fantastic for me, I can tell you that.
Go ahead and wash your back off here with some cold soap. Disinfect the back area. Standard prep. Or cannulas that are specially designed, and I'm not sure if you can see this or not, and perhaps you can turn the light on, and you'll be able to see that the needle is insulated with a silicone type of medium, and the tip of the needle is exposed. And so what will happen is the needle will be placed, and the tip of the needle will emit a radio frequency signal which will heat up the surrounding tissues, and this section of the needle will get hot. So if we're able to place this section of the needle next to the nerve, we'll create a burn or a lesion or a cauterization about 3 millimeters circumferentially outward from the side of the exposed tip of the needle. This is a probe that will be placed through the needles and then attached to a radio frequency generator machine. And this probe is able to record both the temperature as well as deliver electrical sensations and radio frequency current. A little tiny pinch and a burn. I'll give you a lot of Novocaine. It shouldn't be too bad at all. Pinch right here. Not sure if you're able to see the monitor at all. If you could direct the camera to the monitor, I'd like to show the audience where the nerve is located on the x-ray where you'll be looking for the nerve. So we use what's called a Scotty dog view to localize where the medial branch nerve should be. It's a little hard to see, and I know that sometimes the monitor doesn't show well on the camera, but the tip of this needle located right here is located at what would be the eye of the Scotty dog. Just gently advance the needles into the correct position where I had previously shown the nerve should be located on the spine model, which is essentially where the eye of the Scotty dog would be. All the needles at this point appear to be placed, so I'm going to take some x-rays to confirm proper needle placement. So the needle tips appear to be in the correct position. One of the complications of this procedure is obviously deadening the incorrect nerve or numbing or permanently burning the incorrect nerve, which we don't want to do. And so we do a few things to ensure that doesn't happen. Not just x-rays, but as you'll see shortly, we're also going to stimulate some of these nerves with electrical current to make sure the patients feel the stimulation in the correct area. We do not want patients to feel stimulation running down their leg. That would indicate that the needle tips are too close to the nerve roots or the sciatic nerves, and we would have to readjust. Went ahead and hook up the probe to the extension cable, which is hooked up to the machine. I'm not sure if you can see, Ashley, but I'd like you to show the radiofrequency generator.
And have we got news for you? You better listen. Get ready, all your lonely girls, and leave those.
So now we've allowed the lidocaine to set up for a few minutes, and so hopefully Dave doesn't feel any discomfort, but I'm going to advance the probe or the cannula down each of the needles, which will then allow the tip of the needle itself to heat up. The distal 10 millimeters of the needle is going to heat up now. If you're able to see the generator now, the generator on it, you can see that the temperature of the distal tip of the needle is about 85 degrees Celsius. 100 degrees obviously being boiling, so these are pretty hot. And just let me know if you feel any pain, Dave. This procedure will be performed for 60 seconds. After 60 seconds, we will repeat the procedure at each of the other 3 needles. Some doctors may do 85 or 90 degrees Celsius. Some doctors may do 90 seconds or 120 seconds. Some doctors may rotate or adjust the tip of the needle and then burn again. But in our experience, a simple 60-second burn in properly placed needles at 80 degrees to 85 degrees Celsius is sufficient. And we'll just take the stylet out. Go to the next one here. Situate it. Take the other needle out. You can still feel that the tip is somewhat warm when you touch it. And the last one right now is on. And we'll be done with this treatment in about 53 seconds. So the procedure is all completed. The patient has been washed off, the bandage is applied, the pants are back up, and we're going to go ahead and take him out to the recovery room now. So essentially we'll slide him off the table. You let your legs just slide off it. You can go ahead and stand up in front of me. We have a small chair behind you here. We'll just back you up away from the table. Give you a footrest here. And again, Dave, thank you very much for allowing us to record this procedure. I very much appreciate it.